Is an LRI needed for this eye? The Iowa reps claim that for presbyopic correcting IOLs that no LRI is needed if astigmatism is less than 3/4 diopters. They fail to mention that this is a vector-adjusted astigmatism. With the rule, astigmatism is increased by a temporal incision. An eye with 0.7 diopters of astigmatism at 90 will increase to 1.1 diopters at 90 with a temporal incision if your surgically induced astigmatism is 0.4. Thus, you will have a poor result on your presbyopic correcting IOL. On the other hand, against the rule, astigmatism is reduced by temporal incision. We'll just switch the flat and steep axis on the above example. An eye with 0.7 diopters of astigmatism at 180 will decrease to 0.3 diopters at 180 with a temporal incision if your SIA is still the same as the above example of 0.4 diopters. These are simple examples. In real life, the steep axis is not 90 degrees from your surgical incision. I will go through some examples on how to use the Microsoft toric calculators for this. Data is entered by the technician. IOL master keys and axes are used. Use version 5 and above software. Repeat if not consistent. 3 readings per eye are printed out compared to auto keys and topo sim keys. Next, we'll go through some examples. This is the Microsoft toric calculator site. You see it up here. The first time you have to enter which country you're from. Then next there's an agreement on the terms. Click on I agree. And then we bring up the data entry site. My staff enters my initials. Patient's name, in this case I'll just use the initials. This happens to be right eye. The flat K's are 43.29, axis 75. The steep K is 44.29. Steep axis 165. And we put in a 10.5 diopter IOL. My surgically induced astigmatism, I use 0.4. And I insert the lens at 225. This is one of my bimanual incision sites. Check everything and click on continue. This gives the preliminary data. You could check it at this point and correct anything. If you miss something, you can always go back up by using the return arrow on the browser. The legend is here showing the steep axis, flat axis, and your surgical incision. Click on continue. And here, our preoperative astigmatism was 1 diopter at 165 degrees. The vector adjusted astigmatism in the axis is 1.25 diopters at 157 degrees. So this is a significant amount of astigmatism. So as you can see, if we look at moving this to the steep axis, we move back. Into the steep axis, 165. Click on continue. We're in the steep axis now. And then this time we have an astigmatism of 0.6 diopters at 165 degrees, which is an acceptable amount. Now, if this is difficult for some people to operate on, we'll go back and move this to 180 and see what kind of results we get. And as you see, here's the preoperative diagram. We're a little bit off the steep axis. but still an acceptable amount of astigmatism, 0.68 diopters, so an LRI does not have to be done. Our next example will be one that we have to do an LRI on. We enter initials again right here. Since this is the second time, it pops up. Patient initials are N, M. Again, it's the right eye. The flat Ks are 43.83 diopters. Steep flat axis is 7. Steep Ks are 44.82 with a steep axis of 97. The LRI implant in this case was a 17 diopter lens. Again, we put in 0.4 and our standard incision site. Click on continue. This is what we see here, the steep axis here, our incision site. Click on continue again. And in this particular case, our preoperative astigmatism, 0.99 diopters at 97 degrees, becomes 1.5 diopters at 107 degrees. Now let's see about moving the incision toward the steep axis. I couldn't move it to this position here, but we'll move it close to it. Click on the back arrow, and let's move this to 250 degrees. And then check it again, and then click again. Now this reduced the astigmatism to 0.82 diopters at 109 degrees, but this is not adequate for a presbyopic correcting lens, so in this particular case we'll do an LRI. This is the IMO site for the LRI calculator. I use this to confirm the calculations I get from the palm scan. The palm scan, in addition to the pachymeter, has a LRI calculator built in. Push continue. And just like the Alcon site, there's a accept agreement. Put in the step, puts in my initials. Then the patient's initials. For the nomograms, you need the age. We use Napa. The steep meridian was 97 degrees, and the flats auto entered at 90 degrees from that site. The steep Ks were 44.82, and the flat Ks were 43.83. I don't put in the depth here. This program here only gives the thinnest coordinate depth for one of the arcs, and I have found both arcs tend to have different depths. We're going to do this surgically. This astigmatism is 0.4, and the axis of my incision is 225. We want a temporal view, so this shows a picture here so we don't get confused. The eyebrow, this is 180, 90, and 270. Click on continue. So this is the results. We need a pair 40-degree arcs on 107 degrees. So you could print this out and then measure the thickness here and here. Usually I get 3 measurements in the area of the arc and go 90% of the thinnest arc. So that's basically how to do all this.